Medicaid is second-class health care. If it's so good, you know, is that what you meant by saying the same kind of coverage to members of Congress? You know, DeMint and Graham called their bluff. In the Fix-It Reconciliation Bill, DeMint and Graham and others proposed an amendment that said members of the White House staff, members of Congress, and members of congressional staff will all be covered by being dumped into Medicaid. And guess what? For some strange reason, the Democrats voted that down. I thought they just wanted everybody to get the same kind of coverage. Guess it wasn't good enough for them. Oh, we were told, remember the president, I'm not going to tax anybody who makes less than $250,000 a year. Sounded really good. Except this bill has huge taxes on drug companies, on drugs. It has huge taxes on medical devices. It has huge taxes on insurance companies. Now, who is going to pay those taxes? I'll tell you who. Those taxes are going to be paid by sick people who need drugs to manage their disease. It's going to be paid by Uncle Martha, who needs a hip replacement, and Uncle Harry, who needs a new heart pacemaker. It's going to be paid by everybody in America who has an insurance policy. And don't look, it's all going to come out. It's all going to come out that all of these things we've been told that were a bill of goods. In fact, there's a new study that literally came out from the actuary at the U.S. Department of Health and Human Services. It came out this week, and I've been reading it. Exciting reading. Let me read you a couple of things. It estimates that the amount of money that will be paid in fines by companies and individuals to the federal government because of the so-called individual mandate that the state's attorneys general are challenging will be $120 billion over the next 10 years. Think about that. The government is going to fine us $120 billion. It said, quote, by 2011, quote, the national high-risk pool funding will run out, resulting in, quote, much higher premiums, end quote, for every insurance policyholder. Quote, price increases, cost sharing, and or changes in providers' willingness to treat patients with low reimbursement health coverage will be the result of the program. These are the guys in charge of now implementing the program, and they're already starting to warn this is a disaster coming. But you know what my personal favorite is? My personal favorite was the president, who said earnestly, articulately, reading very well from the teleprompter, quote, I will not sign a bill that adds a single dime to the deficit, end quote. Oh, don't laugh at him. He was telling the truth. It's not going to add a single dime. It's going to add gazillions of dimes to the deficit. And it's going to do so in a way that sent Bernie Madoff to jail. Look, I'm restraining myself. I want to rant and rave and hyperventilate like you've never seen. No, I don't. No. It's an ugly sight, man. It's an ugly sight when I really get going. But I am furious about this because it shows the worst of Washington. It shows the worst of the process. And the President of the United States sanctions it. This bill double counts $53 billion in Social Security payroll tax payments. It says, as a result of this bill, 9 million people are going to lose their coverage. Their employer is going to give them some additional money for cover up to pay for, to make up for not having health insurance. And as a result, people are going to get pay more in taxes, and they're going to pay $53 billion into the Social Security Trust Fund. And they double count its use. They say that $53 billion goes both for the benefit due that individual for paying into the trust fund, and it goes for the current expenses of the health care program. They create a new long-term entitlement called CLASS. You can buy a policy for long-term care from the federal government, give you $50 a day when you need it for coverage, and you pay in, they say, $70-some-odd billion, $72 billion worth of premium payments over the next 10 years. And they count it twice. Once as a premium payment for the insurance policy that's going to have to pay you a benefit, and then to go towards the current expenditures of the health care program. They got $456 billion in Medicare cuts in there. Oh, that's not going to cause any problem for longer lines for senior health care and no rationing whatsoever. It's easy and painless to cut it. And not only that, but it's got this great advantage. We got a Medicare system that is $38 trillion in the red, unfunded liabilities over the next 75 years. We're going to cut $456 billion over the next 10. And that's going to ripple through with a lower baseline of spending for the next 65 years after that. And guess what? It means nearly $30 trillion worth of savings for Medicare. We're going to take that $456 billion in savings in the first decade alone and apply it to the unfunded liability of Medicare, and that means we're going to be much more solvent over the 75-year window. Oh, incidentally, did we mention that we're taking that same $456 billion and at the same time using it to pay the current expenses of the health care program? Only in Washington can you do this, spend the same dollar twice. I got a 21-year-old at school. In fact, I literally got a phone call from him tonight talking about his budget. You know, the kid's got a little bit of an issue there. I got a certain amount of money I get each month, and I've spent more than that. Dad, can I have some more? Well, in Washington, it's, hey, we can spend it twice. And they expect us to believe this. We sent Bernie Madoff to jail for doing this kind of stuff. I think they bailed Jeff Skilling of Enron out of the pokey in order to figure out how to finance this thing. Oh, it's going to be $143 billion in the black. But they double count. And then they took the Medicare doc fix. You know, we have to adjust the payments every year to docs to keep up with inflation. They take the Medicare doc fix, and because the cost of it for the next 10 years is $208 billion, they sort of set it aside and said, don't worry, we're going to just ignore that for the time being. Nobody will see it behind this podium, like down here. Yes, you can. This thing is not $143 billion in the black over the next 10 years. You take out the 53 and the 72 and the 456 and account for the 208, and then adjust the numbers a little bit for the effect that that has on the overall spending, and this thing is $618 billion in the red in the first 10 years alone, if you use real numbers and real accounting. We do this, and the country is going to be going off the edge of the cliff. We do this, and we're going to wake up. Ironically enough, year 7 of the program, the last year of his second Obama term, if he were given one, and we're going to find ourselves in an utter disaster. And I've become convinced. I'm not a paranoid person. I'm not a conspiracy buff. Heck, I'm Norwegian American. I believe everybody's honest and forthright. I'm an idealistic young guy. I've become, however, convinced that the whole purpose of this is to make it so bad and so big that at the end of it, we end up growing our government permanently to a much larger size. That we end up saying, oh, well, let's do the responsible thing. We got to raise taxes to pay these gigantic bills. And what we end up with is European-style taxation. We end up looking like some little country in the north of Europe, some social democracy. And by God, if we do that, we're not going to be the United States of America any longer. We're not going to be a major dominant power. We're going to be a second-rate economy that can't pay its bills. The good news is we got time. The question is, do we have will? Out of the $950 billion, over $900 billion of it doesn't get starting to be spent for 4 years and is done fully ramped up for 7. And the question is, in the years ahead, the 4 years ahead, are we going to be able to do something to turn this thing around? The first thing we got to have is will. And the second thing we got to have is better ideas. And the good news is that over the last year and a half, we've started to get better ideas and, more importantly, a willingness to talk about them. Andy Card can tell you this. We would have meetings at the White House with members of Congress to talk about health policy, and the few Republicans who would show up were like, please don't make us talk about this. I mean, get us talking about defense or taxes or values, and our members of Congress and our candidates are fluid and excited and able to talk about it. You get them talking about something like health care, and they're like, oh my God, don't make me talk about it. Or at least that's the way it used to be. But they've started to find their voice in the last year and a half. Because guess what? Our conservative principles generate better ideas. We're the guys who believe, and gals who believe, that we ought to be able to save tax-free for our out-of-pocket medical expenses. You can do so for education and retirement. Why not the other big expenditure in life? Health. So we created health savings accounts. Do you know they reduce in the health care bill the amount of money you can save tax-free? We're the people who believe that the tax advantage ought not only go to the company, but it ought to go to the individual. Why do we give the tax break for health insurance just to the individual? What about the people who are self-employed? What about the people who want to be able to take their benefits with them from job to job? We're the people who believe in being able to do that. We believe in transparency, in pricing and quality, and we don't have